Okay, hello. My name is Aaliyah and this is Javier Lopez. And I'm going to be performing an oral facial examination on you today. Okay, so to get started, first I'm just gonna check your face, and I'm just gonna look at the overall symmetry of your face to see if there's any abnormal movements or if there's any mouth breathing. Just go ahead and look at me straight on. Okay, looks good. All right, next I'm just gonna look at your lips. I just want to look at the shape of your lips and the size of your lips and relevance to your face. Okay, looks pretty good. Shape is good. Size is good. All right, next I want you to go ahead and pucker your lips like this. Okay, I'm just looking for the range of motion to see the symmetry. I'm also going to check for strength in your lips. So it looks pretty good. Symmetry's good. The range of motion is pretty good. Then next, I'm going to have you pucker your lips again. And I'm just going to push the spoon against your lips just to test the overall strength of your lips. All right, looks good. Okay, next I want you to go ahead and smile for me. With your teeth, please. Cool, all right. I'm just looking at the overall range of motion to see if your smile is symmetrical. Do it one more time for me. Okay, looks good. All right, next I want you to go ahead and puff up your cheeks with and hold in some air like you're gonna blow a balloon. Yep. All right, I'm just gonna push lightly against your cheeks. I'm looking for lip strength and then any nasal emission, which is if there's any air escaping from your nasal cavity. Okay, looks good. All right, next I'm gonna look at your jaw and your teeth. Right now, I would like for you to go ahead and open and close your mouth like so. Okay, looks good. I was just checking for range of motion. That looked pretty good. Just looking for the overall symmetry of your mouth or of your jaw. That looked pretty good too. The movement looked good, and I didn't hear any noises or popping coming from your jaw. So that looks pretty good. Okay, next I'm just gonna look at your bite. So go ahead and bite down for me, kind of like just once, and then kind of just move your lower lip so I can kind of see good. Okay, looks good. Go ahead and smile for me again. Okay, looks like you have all your teeth. The arrangement of your teeth looks pretty normal. See, the bottom row of your teeth is kind of a little bit jumbled, but nothing too bad. All right. Looks like you have a normal bite as well. Your mouth looks pretty good too. You know, it's moist, healthy, all that. All right. Next, I want to go ahead and look at your tongue. So go ahead and just open your mouth for me so I can see your tongue. All right. Looks pretty good. The color looks normal. I see a little bit of like jerkiness in your tongue in its resting position, but nothing too bad. The size looks pretty normal. Your frenulum looks pretty normal as well. All right, next I'm gonna have you move your tongue in certain movements for me just to check if you can do it. Can you go ahead and stick out your tongue for me? Okay, looks good. Go ahead and put it back, like back of your mouth. Yep, looks good. All right, now go ahead and move your tongue from left to right like this. Okay, looks good. Now I want you to go ahead and move your tongue up and down. Okay, that looks good as well. All right, next I want to have you go ahead and do this for me. Okay, seems like your tongue pop is a little reduced. Next, I'm just gonna check if you have your tonsils and how they look. Go ahead and open your mouth. All right, looks normal. They're not inflamed. All right, next I want to go ahead and look at your hard and your soft palate. So go ahead and open your mouth for me again. Okay, looks good. It looks pretty pink in there. I don't see any clefts or fistulas. It looks really healthy, pink and healthy. Awesome. All right. Now I just want to go ahead and listen to you breathe for a minute. I'm just going to check to see if there's any mouth breathing or if your breathing mechanism is adequate for speech. So go ahead and breathe for me. Okay, sounds good. I don't see any mouth breathing, no irregular pattern. Seems like everything is good for speech production. All right. Next, I'm just gonna look at your overall nasal cavity, see how it looks. Everything looks normal. I don't see any deviations to the right or to the left. I don't observe any hyponasality or any hypernasality, so that's pretty good. I also don't see any audible nasal emission, so that's good as well. I just want to ask you a few questions. Have you ever sucked your thumb before? Or do you suck your thumb? No? Okay, how about tongue sucking?
No.
No? Okay. How about grinding your teeth?
No.
Okay, cool. Okay, your speech and conversation, when we just spoke right now, it seemed pretty intelligible, so that's good as well. Okay, next I'm going to check your diatokinesis rates, and I'm going to do this by having you go ahead and repeat these certain sounds for me. And I'm going to go ahead and use a timer to do so. So it's going to be a total of 1, 2, 3, 4, 5 sounds I'm going to have you make for me. So the first sound you're going to make is going to be puh. And I want you to go ahead and say it. I want you to take a deep breath and then say puh as quickly as you can for as long as you can. Or until I let you know, until I tell you to stop. All right, so go ahead and take a deep breath and then say puh as fast as you can. Go.
Pa, 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 pa.
Okay, that's good. Thank you. All right, the next one I'm going to have you say is tuh. So again, go ahead and take a deep breath and say tuh as fast as you can, like so. Tuh, 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 tuh. All right, ready? Go.
Ta, 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 ta.
Okay, that's good. Thank you. All right, we just have 2 or 3 more actually. Next, I'm gonna have you say "ka." Same thing. Take a deep breath and say "ka" as fast as you can, like this. Ka 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 ka. Ready?
Ka, 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 ka.
Good. Thank you. All right, next we're gonna say "pata," and again, just take a deep breath and say it as fast as you can, like so. Pata 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 pata.
Pata, 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 pata.
All right, that is good. Thank you. And last, I'm gonna have you put those all together, and we're gonna say pataka, 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 pataka as fast as you can. Ready?
Pataka, 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 pataka,
And that's
pataka.
good. Thank you. All right, and that concludes my oral facial examination. Thank you.